So thank you for being here tonight. Uh, I think I'm crazy, or some people think I know I'm crazy, but some people think I'm crazy for all the emails and all this stuff. But, there's so many changes this year, especially for people under 65, and a ton of changes for Medicare too, that, I really want to make sure people understand because not understanding this will lead to massive headaches for you and other people that don't know what's going to happen. And they're easy pickings for all the scammers out there. And I want to thank you, Bill Ashton, John Osmond, Brian Caron. How's the weather in Florida, Brian? Hillary Marvell, Scott Shalacy, Shay, Scott Fain, uh, Bill's note taker like me relies on AI to make notes and copies, and Carl. So I'm going to give it one more minute, and because there's a couple of people that are almost in, and then I'll get on with the show here.
Mike, may I ask you a question?
Sure.
Yeah, I joined your YouTube channel, but I didn't see any new videos. They were all like from years ago.
No, then you're on the wrong YouTube channel. Go for at the medicalinsurancexchange.com, and you should see there might be a couple of emails from videos from years ago, but look for the channel that looks like the logo you see here.
Okay. Okay, thanks.
Sure. Okay, let's get going. Happy winter, everybody. How's it feel to be in Texas on a blue norther? I'm going to ask Claudia to say a couple of words. Claudia Ramirez is a licensed agent and has been working with me for 2 years, and is just awesome, keeps me in line and runs circles around me. Claudia, can you unmute yourself?
Yes, I'm already here, Mike. Hi,
All right.
How is everyone doing today? Finally, a little bit of cold weather over here in Texas. So thank you for joining. Mike has a lot of information to share, and feel free to send messages in the chat, and we will address them after Mike finishes with the presentation. If you have any doubt or anything, please just feel free to put a note or something there. We'll answer them at the end. Thank you.
All right. And Claude, would you mind muting everybody except for
Sure.
me?
You will have to unmute yourself, Mike, okay?
Okay. I hope I can pull that off. I can. Yay. Okay, I'm recording this in a couple of places, so one or the other will work. I'm not going to be able to reliably put together a transcript, but I've put every webinar for Medicare and for Obamacare or healthcare.gov on a YouTube channel at the medicalinsurancexchange.com. You should see a logo kind of like what's on this picture here. Claudia's been instrumental in helping me with branding so that, my ugly, horribly put together slide presentations, business cards, and everything else look like it's from the same company. And we've got a functional website and social media presence that will continue to expand. And I'll be doing other webinars during this coming year to be talking about long-term care and short-term care options, disability, life insurance. There's a life insurance plan for everybody, not for a pitch, but this is not a pitch fest tonight, but I just want you to know that I'm not going anywhere, even though insurance companies are eliminating commissions and trying to minimize the role of a broker so that they can basically control the conversation. I'm not going anywhere, but I do need to expand in some other areas that, I'm as good as anybody out there, and we'll be making up for the shortfalls in some of these other areas. So tonight, the topic is healthcare.gov. And despite what you read and what constitutes news, some things have changed since last week, even since last night. And I'll get into that. But there's many things that will still come into play, and I'll get into that too. There's still some big unknowns because of the gridlock in Washington and midterm elections in November that may determine who controls the House. A lot's at stake, so both parties are clamoring for votes, basically, and so it's going to be total gridlock. But there is some signs that there will be some negotiation, and some more reasonable heads or more reasonable people will come to some kind of agreement after open enrollment is started. That doesn't mean you don't have to do some things now. I'm going to get into those. And I'm not going to apologize for the long emails and the over communication, because the more you understand what's going to happen, and you understand that, I'm in this market, and also the market, one of the top people in Texas for not only ACA plans, but also Medicare. With all the changes coming, my time is very limited. So I saw this coming earlier this year and have been using webinars and other smarter forms of communication. Then, as much as I love to talk to people, and those of you who know me for a while know I love to talk, and I will talk your ear off and love to get to know people, I have to be smarter and be more guarded with my time, especially right now, because I'm literally spending 18-hour days since mid-September preparing things, and since October 1st sending out quotes and plan comparisons for Medicare clients, and now I can do that for ACA clients. And no sooner do I send out an email than I get, literally today, I probably answered, instead of completing this webinar presentation, I probably answered texts, emails, and phone calls from 50 people who hadn't read the email in total to understand, that you have to be patient. Every time I answer a email message and a text message, and I feel an obligation to do that, but that takes me away from being able to prepare the plan recommendations that Clau and I are working on. Klau's a licensed agent, very, very, very smart. She's also bilingual, and 40% of Texans in other states are English as a second language, and she is so far ahead of where I was the first year. I'm really proud of her and honored to be working with her. But we're going to talk about what's in store now, right in front of us. The first day of open enrollment, believe it or not, is Saturday, 2 days from now. And still there are massive changes that have not yet been revealed. I'll talk about some of them. So let me get on, and there we go. All right, my credentials, blah, blah, blah. I've got over 20 years experience. I've been speaking on healthcare. I'm considered a healthcare subject matter expert, and I've been speaking publicly for the last 50 years, and have a really deep understanding of healthcare issues and options, and also serious, critical, and life-threatening conditions, some of which I know of from my experience with clients, and some of which I know personally because I live with them. Now, here's some housekeeping. First, please put your first and last name and your email address in the chat, because there are some new people on this call. I want to make sure that you get the recording. Everybody who is a client or a former client or have contacted us this year asking for help will have been automatically getting the emails and also the recordings and now the links to the YouTube presentation um, for both Medicare and Obamacare healthcare.gov. So I see 3 people, I think, have put in their first and last name and email address. I'll leave this up for a second, but the next thing, most people, I assume, on this presentation have completed this form. You don't have to complete it again. This is for people that are under 65, unless they are resident aliens who are not eligible for Medicare. They can also apply for coverage through healthcare.gov. I can't emphasize this enough. This is a secure and encrypted form. I can no longer, and people are still doing it in spite of, please not to. They're sending me their protected health information, which I can't, it leads to all kind of problems if your email or my email gets hacked. This allows you to pass everything I need for you and every member of your household in order to get the information and to be able to then prepare recommendations and also, plan comparisons is also recommendations. And they'll be based on which of your key doctors and hospitals are in each plan's network in your area and also your medications. And then I'll make a recommendation and I'll bring up points that you may not have considered and some nuances between the different companies and the networks and type of networks and the plans and the plans. Each plan's networks, there are. It's referred to as ghost networks, where they appear in directories, but they haven't been updated. So when you call the doctor, they say, "Well, we haven't contracted with that company for the last 2 years." So I know who are the abusers of that. There are also some companies that are no longer participating for 2026. And there's also some major turbulence in terms of contracting between major insurance companies and hospital health systems for this upcoming year. So you can't assume that just because your plan was the right plan for 2025, it's not going to have anything. Next year's plan and what's the best option. It may be a lousy option, but it's the best of the available options. I'm going to help you through that and lead you through that. So here's the thing. I've got about 10 people on this call, I think. How many, Clau? How many people are on this besides the AIs like mine?
13.
13. All right. If you are interested, anybody that has completed the form, I want you to email me when we're done here. And believe it or not, beginning Saturday, I will spend tonight and tomorrow, and possibly Saturday morning, sending out your plan comparisons based on your information you submitted, and then we'll set up a time if you're interested this weekend to be able to review and discuss and also enroll you. I want to get started on this. I've spent the last 6 or 8 weeks on Medicare, helping people on plans for Medicare, which I'm a member and I love it, and it's changing too. But I'm looking to do something else and get adjusted to the changes that I need to be aware of that are occurring at healthcare.gov and other options. So if you're interested, send me an email, put in the subject line, contact me for enrollment this weekend or something like that, and I'll be in touch. Okay, here's the link. You're going to be at, if you haven't done it, you don't have to do it again, but you have to include your doctor's first and last name spelled correctly, because there are so many Smiths and Jones and Chapmans and Ramirez and other names that may be not the doctor or not the primary care physician or PCP or whatever specialist that you want to go to. Also, hospitals. There are some major shakeups in which plans are contracted with which hospital systems. And finally, the name, dosage, and frequency of your medications. Here's something else. When you complete this, include the information for all of your family members who will be on your 2026 tax return. This is not what you will pay in April of 26. Your 2026 tax return is who will be on your plan in 2027. So even if they don't need insurance, maybe you have a spouse who's on Medicare, it still determines household size and age still determines who's eligible for a premium tax credit and who isn't. Now, in the comments field, I also want you to put the approximate height and weight of each family member. And then any member of your family not living in the coverage area or out of state, they're not going to be covered on your plan. So I need to know that. And also, if you have a student who is a college student away from school, I need to know that. So put all that in the comments area so that I can make recommendations for you, because you don't want to necessarily have everybody in your household or family on the same plan. Finally, typo. That's not Chapman. That's not how I spell my name. MT Chapman at themedicalinsuranceexchange.com. That's where everything will be coming from. It may end up in your spam folder if you don't do that. Finally, patience. Right before this presentation, I got an email from somebody who submitted their ACA form, through the secure and encrypted link on October 3rd. And in spite of multiple emails and webinars that had not been paid attention to, she had emailed me, do you have my form? And when am I going to get the response to you? Well, open enrollment hasn't even begun. I can't do that. So, this is the kind of stuff that I don't want to be doing. And each one takes about a half hour. So please, unless it's an emergency, please, please limit the calls and texts and emails. That's the reason for having these webinars and for chats, for the chat function, to be able to answer everybody's question. I will get back to you. Okay, I'm not going to be able to respond to every single call or text or email that comes through for stuff like that. That's why we're over communicating. Now, there's a lot of stuff changing. This is a fancy slide that just basically says, hey, I am here to solve your problems, because in Washington, D.C., and in Austin and all across the country, things are changing, and things are changing, for us too. We're not getting any younger, nor is our family members, and life happens. So everything is changing, and I love to solve problems and help people. That's my purpose in life. There's a lot of changes that is causing inflation and healthcare. Forget insurance for a second, but healthcare inflation is expected to be at least 11.5% in 2026. That's running at that rate this year, and I wouldn't be surprised if it's higher. And that's average, including employer plans. So you can imagine what's happening to individual insurance options. We're all getting older. We've got declining birth rates. We've got politics up the wazoo impacting all types of healthcare policies, insurance regulations, furloughs and terminations at Center for Medicare Services and healthcare.gov, Health and Human Services. It is, they're running on a skeleton staff. When the AWS outage occurred this week, it took a couple of days for everything to get back online for Medicare.gov. and healthcare.gov. Why? Because there's nobody in IT working there. Now, here's some things. Just I'm not going to review this, but for those that have joined that have never been on this kind of plan before, who have been coddled in an employer plan, it's a totally different ballgame with individual insurance. You have network limitations, and plans through the Affordable Care Act are the only plans that will cover any and all pre-existing conditions and include mandated wellness benefits at no additional cost. And Texas is not unique in this, but there is no out-of-network coverage. And so that means you may have some travel gaps. And it also means that you can forget about looking for a PPO plan. I get so many calls from new clients who have just come off an employer plan for the first time that say, "Oh, I'm looking for a low deductible and plan that I can afford and has all my doctors." I say, you just described the ultimate unicorn plan. They don't exist. I'll help people make the best of the available options for each member of their family. Most of the plans that are in Texas and in other states are HMO plans, which most people have not had an experience with. This requires a referral from an in-network primary care physician that you can either select or you will be assigned to, who will make referrals to specialists and for specific and expensive procedures. If you don't have a primary care physician, you will have to set up a new patient appointment in order to get a referral to a specialist that's in network. And then you'll have to make a new patient appointment with that specialist. And December and January is always the hardest time to do this. Because why? It's not because they're necessarily paying skiing in Vail or something. It's because people are trying to use up their HRAs or their HSAs or get all the wellness benefits in before the end of the year. Also, as I mentioned, if your key doctors are out of network with a plan, then you're going to pay out of pocket. And the doctor or hospital isn't going to see you unless you can either verify that you have coverage for them or that you give them a credit card or something to pay in advance. So that's what I do. I verify the directories. I know which ones are suspect and which ones are pretty reliable, but I will help save hours of time because of experience and because of the tools that are available to me that I pay for that make it somewhat easier, but still across several hundred clients, it takes about a half hour each to complete. How much you pay for insurance is based on your adjusted gross pre-tax household income for 2027. Now, this says 2025. For next year, it's actually for what you estimate for 2026. Yeah, you're going to have to guess. You may guess wrong. If you end up if you end up with less income than you estimated, which you don't want, then you may get an additional tax credit to pay your taxes in April 27. If you end up making more money, and this is for your household, not you personally, but people that are on your tax return for 2026, if you end up making more money, you will have to pay some of that premium tax credit back for the months that you're on the plan. Also, don't be fooled by low deductibles. Deductibles don't matter. There are some plans that have silly low deductibles, but when you add in the coinsurance, you'll see that it might be $9,600 next year. And so by reviewing out-of-pocket risk and then considering how to minimize some of that out-of-pocket risk through additional coverage, you can get to a plan that is as affordable as it can be while you limit your risk. So, if you overshoot it, you're going to have to pay some of it back. All right, premium tax credits. And this is all subject to change and sausage being ground in Washington, D.C. after the midterm elections, my opinion. The premium tax credits have been trimmed back to what they were prior to the Biden administration. And I was thinking about this, how to relate to this. Most of you here live in Dallas, and maybe some in other parts of Texas. You remember the department store Foley's, right? And Josky's, right? Well, they were known as the constantly on sale company. Everything was on sale, and to some extent, the grocers, Tom Thumb, Randall, do the same thing. Why would anybody, ever buy anything on sale? Well, this year it's looking like a premium shock because for the last 4 years, the premium tax credits have been ridiculously low. Now they've been scaled back to the original healthcare.gov limitations. So yeah, it is a dollar shock for some people. I'm going to talk about other alternatives that are available, but this is still the only option for you to cover any and all pre-existing conditions. I can't tell you, I've had 2 experiences in the last week of people that somehow they got a hold of my name. One was a lady from New York who was just diagnosed cervical cancer, and she is trying to get treated at UT Southwestern. Wanted to see if she could get insurance. Well, she thought she could write it out and take the risk, and fate would have it, she can't. She's not eligible for premium tax credits. So I recommended some foundations, including the American Cancer Society, and contacting hospital health systems for what's referred to sometimes as charity care. But again, that takes time, and it's unfortunate. And other people that think they can ride, they can beat the odds, and maybe you can beat the odds on a short-term basis. But do you really want to take that risk, or have your spouse or loved ones take that risk? So, it is what it is. I use the Foley's and Josky's example. I think Kohl's is another example these days. If you've been in a Kohl's store, they're junk houses because everything used to be on sale, and they used to sell everything on a weekend ad at 50% off, or buy one get one free. Well, it's kind of been that way for premium tax credits, and that's it. A couple of other things. The premium tax credits are based on the annual federal poverty limit guidelines. Below 100% of the federal poverty limit, and I've shared that in the past in emails and also webinars, but it's worth repeating that below 50% or 100% of the federal poverty level, there is no premium tax credit. So you want to do what you can to show enough income and estimated income next year to at least get to 100% of your federal poverty limit. Because then you'll pay, if you're below that, the insurance is going to be unaffordable. If your income that is less than 150% of the federal poverty limit, then your children under age 19, their application will directly go to CHIP, Children's Health Insurance Plan in Texas. And it's really a good program with a good network, and it helps tons of children. But it is taking a long time for those applications to get processed, not only because of the current cutbacks, but this goes back to when the federal COVID emergency was lifted 2 years ago. They're still reprocessing people from that. And you want to always make sure that you know this, and I'll talk about some strategies here that you can take. one of the strategies is if your income is going to be low, below 100%, then you can, if you have money in a Roth IRA, you can convert it next year, not this year, but you could convert it next year to and take the tax hit, which would be low based on your income if it's in that level. The premium tax credit value is often 2 or 3 times what the taxes would be on that income. That's one way of getting to the 100% and beyond. Also, if you're beyond 400%, let's say there isn't much of a premium tax credit, 400% next year. Let's say you're beyond 300 or 350%. Well, you can make that adjustment to a Roth or to withdraw from an IRA enough this year so that you can use that to fund living, pay the bills in 2026 but still keep, still have a pretty decent premium tax credit. So you don't have to do that until the end of 2026. I don't profess to be, nor am I a tax professional, but most tax professionals don't want to talk about the dirty business of health insurance. They think it's beneath them. And quite frankly, it's outside of their scope. So if you present it in the right way or need help, let me know. I can explain that. Also, pregnancy. If you or a spouse or a child is pregnant, that person's application will automatically go to Texas Medicaid. Also, plans outside of the Affordable Care Act, if you are trying to have a family or you have an oops, there is no coverage for anything for pregnancy other than plans through the Affordable Care Act or healthcare.gov. The other people that can apply, and I have a number of clients who are from other countries that bring their parents here to stay with them. Well, they can often they won't qualify for Medicare, in which case they can qualify for a plan through the Affordable Care Act. Now, for some people, based on access to doctors, I'm talking about an individual in your family, not the whole family, but maybe there's one person that has pre-existing medical, serious and consequential health issues or mental health issues. Well, that person, if COBRA is an option, that might be the best option for that person, but you can find other options for the rest of your family. If you don't qualify for financial assistance, also COBRA may be the best option if it's available. So here's an example. And this I refer to as unbundling your family's health insurance. And then it's kind of like underwriting 101, except you're underwriting your entire family. You've got one unhealthy family member, maybe two. Keep them on COBRA, all right? Or keep them on a plan through the Affordable Care Act. Maybe have a student who's going to a big state university or something like Ohio State. Yay, Ohio State. Number one again. You want to consider their university health plans. That's often a better coverage at a lower cost for college students. You pay for it by the semester usually, and can enroll during the start of the semester, usually in December for next year. And usually they have a PPO plan, so we'll cover them at home when they're when they're at school or when they're on spring break, drinking their brains out. Out-of-state family members enroll in a separate marketplace plan in their state. Why? Because they won't be covered on your Texas plan. They need to be on a separate plan. And otherwise, why pay for coverage if you can't use it when other plans that will be better? Then you have to determine which, and this is what I'll do. I'll help explain this. So by doing this, it really can reduce your overall insurance cost while minimizing risk among your whole family. Right? You get it? And this isn't something you just do. This is usually, I said a half hour on average. These are the types of things I do that will, this may take an hour and a half to pull together, but I'll do it. Now, here's where we're going to talk about changes. Here's 2026 changes, and there's more to come. You must have, first of all, outside of open enrollment, which begins Saturday, you have to upload proof of employer coverage, loss of coverage at healthcare.gov before your application can be approved for a special enrollment period. And you got a maximum of 60 days to do that. Well, usually if somebody loses their job, they're in shock, they're grieving, they're worried about income, and they're trying to fiddle with the resume and all this stuff. And sure as heck, 60 days have gone by, and then they're out of luck. They can't get coverage that they really need. And you upload the required documents. It has to have the employer's name on a letterhead or an official letter. And I've had some of these take 30 days for approval this year. And now with the funding cutbacks and the reduction of personnel, it could take longer. So this is not something you want to waste time on. I'll talk about this. I put it in the email. I suggest you Google it. Google healthcare.gov data matching issues, or read the email that went out yesterday. These will require you to submit proof. You may not even be able to, depending upon the issue, you may not even be able to complete the application until you upload documentation. And there's all kinds of things. Like if your income estimate is way off from what it's been in the past, that's that's one of many data matching issues. You're going to have to upload proof. Also, I have a number of clients who one or more family members may not have been born in the U.S., but this year, 2025, they're able to get coverage through healthcare.gov without doing this. Not so next year. Anybody that is not a born U.S. citizen must upload documentation, whether that's a certificate of citizenship or naturalization, a green card, or a valid visa, a passport. These are all documents that must be scanned to PDF and uploaded, and then you sit and wait until they get processed. Many, many fewer special elections, all requiring proof. It has been so easy for the last 4 years, 5 years really, from the beginning of the Biden administration. Anybody that wanted to, you could practically blink and get a special election period. You didn't have to prove anything. Now, just a job loss or coverage loss, death, divorce, marriage, remarriage, birth of a child, permanent change of residence outside of a coverage area, which you have to prove with a utility bill with your name on it, or a driver's license in the new state. These are the only ways that you will be able to get a special election period next year. You can't do it on income or any other types of things that were available this year. Now, what is a FTR? It's a failure to file and reconcile. And that's another government acronym. It means that you didn't file your federal tax return, or you didn't reconcile your premium tax credits that you would have received. And this is for 2023 and 2024. So 2024 would have been the taxes you paid in April of this year. You would have received a 1095-A, and you reconcile that with IRS Form 8962. And then you submit that as part of your 1040 or whatever, however you file your federal taxes. If you haven't done this, then you're going to have to quickly scramble to refile your federal tax returns, or you're not going to be able to get covered. Also, if you don't pay your insurance premiums, or you just, let's say right now, December. Well, your premium for December family, let's say it's $1,600. I need $1,600. I'm willing to take the risk. I'm just going to not pay my insurance premium. It's not going to work anymore. If you stiff your insurance company, you won't be able to reapply. You must call healthcare.gov to cancel. They won't prorate the month, but they'll cancel it at the end of the month that you want. And November is just a couple of days away. I'm going to talk about a strategy to get coverage in November, December, and January in a minute here that you may want to consider, but there are some risks involved in that. There are also no automatic renewals where, first of all, there's very, very few plans that will remain unchanged from this year to next year, but you won't be able to just do nothing and have your plan auto-renew. There are a number of 2025 zero premium silver plans. Well, you're going to have to pay a minimum of $5 in premiums, which if you didn't set up auto pay and don't set up auto pay, your insurance will cancel. I put this in the email that went out yesterday. There are now what are called catastrophic plans. They don't have as much coverage as a bronze plan. Those of you that are familiar with that, but it covers mandatory wellness benefits, and it's certainly better than plans that don't cover pre-existing conditions. But you have to file an appeal on either based on not having a tax credit for this year, for next year that you did this year, or there's a hardship case that you can appeal. But it's a form, it's a government form. In the email that went out yesterday, you will get the link to read it, but you can also just Google healthcare.gov catastrophic plans, download the document now and start filling it out. Because if you wait until, let's say, December, when a lot of people wait till the deadline, they'll wait till December 15th, the last day of open enrollment, to get covered January 1st. Well, they're not going to be able to get this done. And what processing time, especially with the number of furloughs and terminations, it's going to take a long time. So best to get on the ball for this now. Key dates, and this is important, and I'll share something here in a minute, but December 15th is the last day that you can enroll in coverage January 1st, 2026. Now, in the past, people wait till the last minute, just like you wait till April 15th to pay your taxes. But this is going to be I can see a perfect storm. IT support down, people maintaining healthcare.gov down, premiums are going to be higher. People are going to wait to the last second to sign up for coverage because they're going to be undecided. And it wouldn't at all surprise me if the last minute, everybody trying to get everything done the last week or the second week in December, that it's going to bring healthcare.gov crashing down. And I don't, it's opinion, but I don't believe that the current administration really would care or would extend the enrollment period if that were to occur. So get it done now. Set an appointment with me after you complete the application. If you're on this call tonight, I already told you I'll put you at the front of the line if you respond to me. There's also a second deadline, and you could apply from December 16th through January 15th, the last day, to get coverage beginning February 1st. And you may want to do that. I'm going to explain why. So just in total, you have to cancel your plans the right way. You would have to call healthcare.gov to directly cancel it. Don't call the insurance company. You have to understand that Medicaid and CHIP are being cut back funding wise, and it's going to have a huge impact on hospitals. It is having a huge impact on hospitals, not only rural hospitals, but also hospitals like, every hospital that that rely on Medicaid for their part of their budget. Now, this may or may not happen, but Medicaid work requirements have been approved for 2026, but nothing is on the table for that. Depending upon what happens in November, those may come back on the table. So just start now getting everything in place, doing your homework. We'll talk about it, and then I'll make recommendations. I already talked about the funding cuts, 90% funding cuts at Center for Medicare Services, Health and Human Services, healthcare.gov, navigators, assisters, all the people that answer the phones at healthcare.gov. There are some actual good ones there, but many of them are newbies, if you will, and are reading off the screen. So expect long wait times on hold. If you call for help, that's what I'm here for. But I've got to guard my time. But what used to take minutes, you could very easily spend hours, even late at night, on hold, and then you're relying on somebody at the other end of the line to really understand and be able to help. And you have exactly 60 days to resolve any issues, no exceptions. So don't wait until the last minute. These exceptions and these changes apply to everybody. Okay, anybody under the age of 65. This is a new rule. Is insurance still a good thing to have? Well, if you want to have access to doctors and hospitals and reduce your risk and reduce cost of medical care, which is crazy. I mentioned in the first email that I have spent years of my life, and I've kind of been a healthcare nerd, but I've spent years of my life traveling to other countries in Central and South America, and Mexico, and Europe, examining other companies' healthcare system, Canada, and talking to people and doctors and visiting hospitals, and they're all failed in my estimation, but we spend about 5 times what every other country spends per capita on healthcare. And I don't see anything being done to fix that. Unfortunately, we're all getting older and less healthy, and so you've got demographics in this country and many first world countries that are working against us. But don't expect to pay less for insurance without taking an unnecessary risk. You don't want to be. You don't want. Well, I'll say that. Premium tax credits are in flux. Now, believe it or not, once we get through the November elections, there is some discussion, and I read for a couple hours a day or evening, usually between the hours of 1 to 3 a.m., about healthcare and what's going on in Washington. And there is some movement. But of course, neither politicians from either side want to really publicize it. But there is some talk once the elections are decided that there will be some negotiations that may end up increasing the amount of premium tax credits, which reduce the cost of insurance. Alternatives. There are no other alternatives other than Medicare, an employer plan, or individual plan through healthcare.gov that cover any and all pre-existing mental, physical, and emotional health issue that will have wellness benefits. So, it's not apples to apples. Short-term plans are an option. They don't cover wellness benefits. the they're not. They often do not have copays. They pay a network negotiated rate. Pre-existing conditions aren't covered, and you could well be rejected for coverage. And also, they have a limitation per calendar year for the time period that you're on it. So, I have had clients that purchased a short-term. Let's see, maybe this goes back 10 years ago. A lady purchased a short-term health plan, broke an ankle in Vietnam or Thailand or someplace, came back to the U.S. and couldn't get covered because she was outside of open enrollment. So there are no special enrollments anymore. During the Biden administration, anybody could blink and get a special election. But a short-term plan, you're going to bridge a time period, and you don't. At the end of that time period, you're not going to have a special election. Also, you might have access to a PPO network, and it might be cheaper. So for a limited time period, let's say the months of November, December, or let's say November and December and January, if you want to ride out and see what happens at healthcare.gov and negotiations in Washington, you could cancel your plan through the Affordable Care Act. I don't recommend it, but it is an option. It might or might not be less expensive, but it would enable you to see if maybe the premium tax credits are extended beyond what they are now that were available through healthcare.gov. And it might give you access to a PPO network. So again, this concept, unbundling your health insurance. Maybe you got a college student that's on a university plan. Maybe you have an out-of-state family member. Maybe you have a typical young and healthy son who, other than car wrecks, thinks he's indestructible, even though he's not. Well, maybe you take that risk for a short period of time. But if you have an unhealthy family member who's managing serious mental, emotional, physical health conditions that are chronic and potentially life-threatening and expensive, then they want to be on a plan through healthcare.gov or COBRA. So I talked about this strategy. You could purchase, say, for December and January, see what happens after the elections, enroll December 16th through the 15th for coverage beginning February 1st. If you're interested in that, send me an email after this, and I'll quote that for you. Christian healthcare sharing ministry programs. 5 years ago, 6 years ago, those were awesome options. Well, claims experience has caught up with them. They're not nearly as affordable as in the past. If you're not eligible for premium tax credit, they might be somewhat less expensive, but they won't cover pre-existing conditions. They won't reject your application, but they will exclude any pre-existing conditions for the first 3 years, and then limitations beyond that. They will give you access to a PPO network. The biggest and the best and the largest is Medishare. They paid every claim in the 30 plus years. If they were an insurance company, they would be considered one of the top 10 in the country. So this is the subject, this is the concept of underwriting for your family. I can help with that. So, my value proposition is really to help solve problems and to do the stuff that would take hours. It's taken me 20 plus years to learn this. I'm very good at this. I've got a new updated website. You can see I'm over communicating as far as emails with Klaus Help, with webinars that are posted on YouTube. And I'll help you smoothly transition to Medicare and explain all that when the time comes. And life insurance, everybody needs a life insurance plan. New website is coming along pretty good. A couple of other things, book appointments, short-term health plans, employer plans. Here's where I ran out of time today to update this with new information. Hold on one second here. There's a couple of things I wanted to bring. Oh, here we go. I bring this up at every webinar or in every public health, every public speaking. How much can you afford to risk versus how much can you afford to spend? And the wrong choice could cost you a whole lot more. So if you know you're married to a cheapskate or you are a cheapskate and you're into comparing prices, or if you're calling a healthcare.gov or a call center, their job is to slam you into the second least expensive plan and go on to the next person on their long queue. So please don't be cheap about this stuff and consider the risk. And also, I can tell you, see this here, see this badge of honor here. That 5 years later, I'm still above ground. You don't want to be wearing one of these things. So don't think that your job, whatever you're doing for your job, or that your spouse is doing for a job, you don't want to be wearing one of these things. There are very affordable diagnostic tests you can have through Quest, LabCorp, nafcclinics.org is a nonprofit organization of clinics all across the country. And there's many in Dallas Fort Worth that you can get no or low cost care for wellness or for urgent care. And I suggest you bookmark that or put it on your phone because someday you or somebody you know may need it. And hospital health systems Methodist is good at it. Texas Health Presbyterian is good at that. They will have mobile labs and free screenings. You may have to drive 20 minutes, but it's a way of getting screenings if you go on to a plan that doesn't have them through the Affordable Care Act. So don't be too proud to ask for help. The 7 deadly sins, you really don't know what you don't know. And I'm still learning stuff. 22 years into this career, I'm staying abreast of stuff each and every day, and I'm planning 6 months out so that I know what's coming to advise and support my clients. And focus on what you do best and focus on your family. And, so return on time invested. Leave the healthcare expertise to the nerds like me who knows the difference. So I'm going to ask you, because there are so many changes, please share this information. Share the link to the YouTube channel immediately, because if people wait until open enrollment, I got to this, but it's going to be too late. You want to do this now because of the massive number of changes. Don't miss critical deadlines. I'm not going to talk about this, but here's my contact info. I've got my email address spelled correctly here. mtchapman at themedicalinsurancexchange.com. Yeah, I offer year-round support, and this year is it's testing me. It's challenging me. And the Lord has put this challenge in front of me, and I accept the challenge. I'm here to serve. I'm here to help solve problems, and it gives me purpose in my life. I don't think about the compensation. It's not like there are many things that would compensate me better for especially given the amount of time I put into this. But I'm passionate. I love what I do, and I feel I'm pretty good at it. So there you go. I've won awards since 2014. Every year is one of the top ACA and Medicare brokers in Texas. I'm licensed in 17 states. I'm here to help and serve. Please be mindful of my time. If you completed that survey, I will get back to you. But don't email me or call me or text me to say, hey, did you get it? Because that takes me away from supporting you and other clients. So thanks again. I'm going to open up for questions.
Hey, Mike, we already have one question. So John is asking, my insurance company is leaving the state and possibly marketplace altogether. Do I still need to call healthcare.gov to cancel this year's plans?
Good question. You will probably be your phone's probably ringing off the hook. Aetna is leaving healthcare.gov. That's the reference, but there will be others. And you need coverage through the end of the year, but you don't need to call to cancel unless you want to consider the risk of a short-term plan for that period of time. Then you want to call and cancel after you get a short-term plan in place, knowing the limitations of it for the month of December, possibly January. But you will definitely have to enroll in a plan for 2026.
Anyone else has any questions?
Yes. One of the documents you said that you have to upload documents to
Yeah, I'll help with that.
before.
See, I have Marvell. I'm I'm a certified broker with healthcare.gov, and if you scan the documents, I'll upload it to your account.
Well, my question is, one of the, I forget which screen it was. It said something about in order to get your application started or approved, you have to show something within 60 days.
Yeah,
If you've been with ACA for like the past 2 years, you still have to show something, or is that
well,
for people
this,
that's new and they lost their jobs?
yeah, it's a little both. If you haven't been born in the U.S., even though you've had a coverage this year, previous years, yeah, you'll have to upload your your visa or your certificate of naturalization, etc., in order to be approved for coverage. If you're outside of open enrollment and you have a loss of job and coverage, then you have to upload those documentation to healthcare.gov to get approved, and it'll take time to process. Or if you move, like in your case, Marvell, if you move from Florida to Texas or vice versa, and reside in that, then yeah, you would have to show a utility bill with your name on it, or a driver's license, or some other form that you have in fact moved if you move outside of the open enrollment period.
Okay, so that's for if you're outside of the open enrollment period. You have
Yeah.
to submit special documentation. Okay.
And the other thing too is if you're not eligible for premium tax credit next year, well, then you can complete the document for approval for a catastrophic plan based on loss of the premium tax credit or based on a hardship. And, I'll help upload those so that however long it takes to get it processed, you would be eligible for a catastrophic plan.
Do you get to view the catastrophic plans before you?
Oh yeah. Yeah.
Okay.
No, you have to actually you have to apply for the plan, and then you apply, and then you submit the documentation and hope it gets approved.
Okay.
There's another question here, Mike. I got a renewal from Blue Cross Blue Shield saying my plan is being renewed. Did I hear you say is no auto renewals?
There are changes in the plan, and what I didn't cover, I was waiting. Many of you have doctors with UT Southwestern, Texas Health Resources, Methodist. Those contracts are changing. Also, some contracts with Scott White and Baylor. So you don't want to assume that doctors that, yeah, you might be able to renew your plan, but then you're not going to be able to see the doctors you critically need. So it's really important that you let me do the homework.
Then there's another question. My income has changed from 2024 from unemployed to 2025 self-employed consultant. What documents will be needed to that income changes from 2023, 2024, 2025 income estimates?
Yeah, good question. Really good question. You estimate for 2026, you would have filed a 1040. And as a self-employed person, I can relate to that because I'm self-employed, have been for 20 plus years. You can deduct your business expenses. So it's not, it's what you declare as your income for your household. And that's one of the documents. And if you don't have that, then you may have to, they may accept, and this is a big may, they may accept a pay stub, invoices from customers, et cetera, in support of your income estimate. And they may challenge it. You may have to appeal it once or twice to get it to pass.
Did that answer your question, Bill?
Yes, it did. Actually, thank you. I do have one other question. If you don't qualify for the tax credit piece of it, can you still help find a suitable plan that would be beneficial for the family?
Yeah, and that's where first of all you have the ability to appeal for a catastrophic plan. That's one option, and then if you're not eligible for premium tax credit for the family, and a catastrophic plan might be an option for limiting the risk and having coverage for any and all pre-existing conditions, no cap. But you may only need that for one or two family members. So that's where the unbundling strategy. We take a look at that, Bill. If you sent me your info, I think you have. Then
I did, yes.
Then I'll go through that, and we'll set a time to go through it. It may take, in your case, a couple of discussions, and then help you settle on a strategy for every family member that will balance the cost, the need for access to care, and then the risk of medical expense risk.
Sure. Okay. Thanks.
Sure.
There are no more questions in the chat. I don't know if anyone else. Well, there's a new question. Okay, no. Just a thank you.
Thanks. Well, thanks for putting up with me and for the long emails. I'm here to serve. I like solving problems. I love talking to people. It's really tough right now and challenging. So understand my physical limitations. And, I'm trying to spread, as is Clow. We're trying to spread ourselves, solve as many problems as we can within the time. And, from here through really the end of January, this is a 6.5 or 6 day a week job. And we're doing all we can. If you've submitted the form, we'll get back to you but you don't have to call or email or text. Please don't, to ask, did we receive it? It's ironclad. It's like going into a vault. So if you completed it, we've got it.
Well, there's no more questions, Mike. So.
All right. Well, thanks. We got through in right about 10 an hour. The first few minutes we were late, fumbling around, or I was, with technology. So thanks very much. Enjoy the rest of your evening, this first day of winter in Texas, or what constitutes winter. And God bless. Have a great day. Bye-bye.
Bye.